Welcome to Heroes of Healthcare, an HCP Live segment highlighting a healthcare professional who is going above and beyond in their specialty. Today we will feature Dr. Lydia Alexander, a physician at Kaiser Permanente, a board-certified obesity medicine specialist, the chief medical officer and medical director at Inara Health, and someone who serves on the board of trustees of the Obesity Medicine Association. Before COVID-19 began spreading rampantly across the United States, there was very little known about this novel virus. Still, people contracted it early on without much information about how they contracted it, who they were in contact with, and whether they would recover. In March, Alexander and her husband both contracted COVID-19 without knowing how. With 4 kids at home and a nervous partner, Alexander kept a brave face to help her family get through the difficult time. During the 2.5 weeks of headaches, muscle aches, and fatigue, Alexander used the time to launch a nonprofit, World Without COVID, with her husband. They both enrolled in observational studies and donated plasma. All the while, Alexander started a new position as the Chief Medical Officer and Medical Director of Inara Health, a digital health weight management company. Her stint with COVID has allowed her to empathize with patients and providers alike, and even helped her guide Inara back into the office setting. Given her experience, she helped outline COVID-19 and return to work protocols to make sure the team is being cared for, all while being able to get back and focus on the patients. Further, Alexander spearheaded a way to have patients return to the office and see physical therapists and health coaches. I had the opportunity to speak with Alexander and some of her colleagues about what it was like to have COVID-19 during the beginning of the pandemic, starting a nonprofit, and her work at Inara Health and beyond.
My name is Lydia Alexander, and I'm a physician who specializes in internal medicine. So that's a physician who treats adults. My background in terms of training is that I went to medical school at the UC Davis School of Medicine here locally, and then I completed my residency at Kaiser San Francisco. And also achieved year there as well.
I started at Kaiser Permanente San Francisco in 2005, and I was her mentor in internal medicine residency program. I might say 2006, 2007, last 2 years of residency. During that time, she was assigned to the Spanish module because she speaks Spanish fluently. And so it was just easier for our patients. It was always a fun clinic when she was in the clinic because she's extroverted. She is extremely smart. Patients like her. She was always, knowledge-wise outstanding. And we became friends.
Once I finished my residency and I was a chief resident, my clinical mentor, a person who I would see, we usually have like a 4-hour block once a week as residents where we see patients in the clinic. So these are not as seriously sick patients. She approached me and had said, we need an extra person to help us out in a practice that I do. It's called medical weight management.
I said, there's only one person that has the enthusiasm, the energy of doing what we do. It's an extra from our working environment. And probably she has time to do it because it's not a full-time position. It's just, you go there maybe twice a week, give lectures, see patients. So it's not a heavy thing. I knew that Lydia did not want to be a full-time physician because of her family responsibilities. So I remember really well going to her home and said, hey, Lydia, I have this, I'm leaving Kaiser San Francisco, and there's this position that, I want you to take a look. So she went there, they love her, she loved the team. And then a new journey started.
And I really had no idea what that meant, because she was my mentor and I highly respected her, and she had invited me to practice with her, and I thought she was one of the most, fantastic physicians I had ever met. Just great bedside manner, super intelligent. I just trust her, and I said, sure, I'd love to work with you and help you out. And that's kind of when I got involved in a field called obesity medicine, which is a subspecialty of internal medicine. So I became board certified in that. And it's when a light bulb went off when I thought, oh my gosh, I can do something for patients. I can reverse their chronic conditions, their high blood pressure, their cholesterol issues, their diabetes, their pre-diabetes, and I can make them healthier than they were before, just by treating the roots. I called it by treating the roots, not the fruits of their chronic condition.
And she dedicated most of her time to her family, raising the kids, being there. So knowing your priorities, and that was her goal. It was so beneficial. It makes you get in touch with yourself, with your family. These are the values.
My husband and I were both early adopters of becoming COVID positive right back in March, and so not exactly sure how we contracted that. But right at mid-March, when when the country and definitely the state of California was coming to a halt and sheltering in place, we both got sick. We do know relatively more about SARS-CoV-2 at this point. At the time, there was a little bit less known in terms of what to do, even masks and what have you. And so I'll say that it was hard to get a test. It took a very long time to get results, and so our experience was that it was scary on a couple different levels.
Interesting enough, Lydia texted me, such a great friend. She texted me like I think 2 days after the sheltering place started. Hey Carla, we're sheltering in place. If you need anything, please let me know. Then time goes by, and then I was just taking a look at Facebook, and her husband comes up and with an alert. I got COVID, and unfortunately my family got it too. Please participate on this. I was like, what? So that means Lydia got COVID.
It was scary personally because you don't know how sick you're going to be. I would say that I had probably a medium case. I never had to be hospitalized. I would not have been able to go to work even, if I could, because I just had such intense fatigue. And I had terrible headaches and muscle aches. So it was sort of like the worst flu that I've experienced, and lasted for maybe a little less than 2 weeks. And toward the end, I'd say that kind of came in two waves. The second wave, I actually also became a bit short of breath. I think there was a lot of concern. What if we get sicker? We're both sick. We have 4 kids. Who's gonna take care of them if something happens to us, even if it's transient, and what are we going to do there? There was concern about, are we going to be spreading this to others? Who have we come into contact with? Could we be affecting somebody else's physical health? And that was especially true for me, because I had my mother does not have very good health and was in a skilled nursing facility, and lives in an assisted living facility. So now we know in California that about 40% of the deaths have come from assisted living and skilled nursing facilities. So, I had a lot of concern trying to think back, okay, when did I contract this? Was I in that facility visiting my mother, because they hadn't had any rules yet about closing those down to visitors? So I think it was a bit terrifying, wondering, we're in a profession, we're trying to help patients, and, could I have harmed somebody? But, if my husband's symptoms came on first and he quarantined, in an extra bedroom, but within days I was also sick. So clearly, it was an imperfect quarantine that he did. And so it's terrifying. You just wonder, do any of my, are any of my kids going to get this? Are they going to be really sick? We didn't know at the time, as much about, how children necessarily reacted to it versus adults. We knew adults could probably be sicker. But it was, you're still kind of wondering, well, if somebody else gets sick, then how are we going to manage them as well? And then just not knowing what the results are. Are you sick, with COVID, and how long is it going to last? And, will you continue to get sicker? So I think I felt some pressure to be the calm voice at home and to be the voice of reason, and not to feel that way in front of my children, or even in front of my husband, because he's honestly much more worried about it than I was.
Being a leader within her own family, I mean, if everybody's sick, I could only imagine we need somebody who's going to be the brave one, who's going to give us hope. That's what we transmit. This is what we, as part of, I think, the untold training for physicians.
To try to be the voice of reason and the voice of, calm, but internally not knowing that, that much, about it too. What if something changed in my condition? What would I do? Though I felt fine right then. So it was a heavy weight, that feeling of responsibility and the concern for my family, including, what could happen with my mother during a situation like this. Part of it is what we ended up doing is realizing that there needed to be a lot more research trials going on, and those were starting to happen quite a bit. And then those research trials really needed people who were COVID positive, COVID negative, and didn't know one way or another whether they fell into either group. And so we needed a lot of people to enroll in studies. And so we founded a nonprofit called World Without COVID, in order to kind of further that, further the scientific progress of COVID research, realizing that we just needed to get more people who wanted to help. And there were so many people who wanted to help, to get them into this funnel, to volunteer for research studies. And because people would ask me, they're just like, well, what can I do to help? And this is one of, I think, the best approaches to take long-term, is to get people signed up for research studies so we can get some answers and move forward.
Between being altruistic and trying to learn with the condition and being oriented to science projects, I think great initiative from her and her husband.
We have been able to get quite a few people into observational studies, which are a lot easier to do. I myself am signed up for 3 different observational studies where I would be checking every single day a symptom tracker. We also became involved in convalescent plasma donation. So my husband and I both donated convalescent plasma, and then started working with we did it specifically at Stanford. And so we started working with the medical director of the convalescent plasma program, or the plasma program rather, there, to see how we could help funnel more people toward them, and then also to do it on more in a nationwide approach. So we became kind of research subjects ourselves, donating. We also enrolled in 2 other immunity studies.
It doesn't surprise me. She's always been a person who leads in terms of what she wants to get done. And so I think at that time, obviously, like I said, she identified a need, and she's a person who's a problem solver. So she's going to go and try to figure out how to solve that. And so I think that's what her and Raj did, was they identified a need through their COVID experience. And she basically helped solve that, both through that foundational activity as well as the changes that she made here at Inara. And so I think that's what matters.
For us, feeling that we weren't helpless, and that we hadn't been sidelined, because I did feel, you do feel a little guilty that you're just, at home, and what are you doing, to make the world a better place. It felt good to be able to put some of that energy into making a difference, in what's going on with the pandemic.
Knowing Lydia, she's always productive, is extremely productive. And I could only imagine being 2.5 weeks in the house. What am I going to do?
And then the program, the medical weight management program that I had been working with, had to, go on hiatus for a little bit, because we could not see the patients in person in the clinic building, and hold, group meetings and those sorts of things that we had been doing, prior to that. So that did free up a little bit of my time to be able to work on World Without COVID. I actually became involved with a local clinic here, that really needed my help, and deals with in medical weight management. So they see a population that is exactly what I do. It's an obesity specialist medical practice, and so I got involved with them because they needed the extra help. And so this is a colleague of mine that I'd gotten to know through the Obesity Medicine Association, and he's just a fantastic clinician. Really, I can't say enough good things about him. And he needed the extra help, and was making the pivot to telemedicine to help this patient population. And so what I ended up doing is, I'm just very passionate about this, this field, and what I do is I ended up coming over and helping him full time.
I would say Dr. Alexander is a passionate person who comes off at really trying to deliver the best care to her patients. I think that's one of the reasons we hired her. She has extensive knowledge both in obesity and lifestyle medicine, and she's able to combine those two to really create personalized pathways for her patients. And so my initial interaction, or the reason why Inara chose her as chief medical officer, was because she really exhibits the passion that we need to really tackle such a huge epidemic. And that passion is fortified or solidified with her extensive knowledge in both lifestyle and obesity medicine.
How does having had COVID affect the way that you care for your patients now while this pandemic is still happening?
I would say that's a good question. It gives me a lot of empathy for the fear that one would experience during a time like this. The fear of is the last interaction I had the interaction where I contracted COVID? Oh my gosh, and just wondering about what the world is going to be like, and your economic livelihood. So I think on several different planes, I have empathy for that, for the experiences of our patients, that you can't always shelter in place properly because you have to do, there's certain essential jobs that have to be done. And, and that if you have a chronic condition, it does give you pause. Or if you live with somebody who is elderly or has a chronic condition, that, that you have to make modifications in the way, in the way that you do things because you want to keep them safe. And I think it also gives me empathy for our staff, because we do have, staff either, that may have a chronic condition or is living with somebody who does.
One of the things that Lydia has done when she came on board is given her experience with COVID and COVID-19, she was able to really outline our COVID-19 protocols and the return to work protocols. So making sure our staff is returning to work safely, and making sure that the way we care for patients is done in the correct manner. And so I think that would have been a tall order to do on myself. And, I went from basically a one physician clinic or operation, I would say, to now having, 9 of us, but with Lydia leading that charge, I think it really helps in terms of management of all our providers. So Lydia was really the one who spearheaded a way to be able to bring patients back into our clinic to see exercise therapists as well as the physical therapists, to be able to have them get that hands-on training, but at the same time stay safe.
In general, the patients we take care of, many of them, not all of them, but tend to, so July 17th, I think it was, additional research has come out, which has identified patients, or people rather, I should say, who have a BMI greater than 30 are all now considered to be in the high risk group. So previously it was a BMI over 40. So even if you don't technically have any other conditions in addition to having a BMI over 30, you are now considered to be at risk for becoming sicker were you to contract COVID. And so that, I think that makes us feel that, we need to be here, in business, seeing our patients, doing the best that we can so we can provide them with with the highest quality care that we can, and we can answer questions and keep them on track. So I became involved with the Obesity Medicine Association. It was formerly known as ASBP, the American Society for Bariatric Physicians, in, I want to say 2012 or 2013. And so I went to a conference because, as I mentioned, I was working with my mentor, Carla, and I wanted to learn more about how to manage patients with obesity, and attended one of these conferences. And I would say, the light had already been going off that this was kind of, I think the wave for the future of primary care is to really get at the root of a root issue, rather than putting band-aids on on all the different chronic conditions, to try to find out what is the core issue. And if we can address that, we can probably make all these other things a little bit better, if not a lot better. And so I became certified in obesity medicine in 2015, and then shortly thereafter, was asked if I would join, or if I would run for election for the OMA board, which I did, and so I have been on their board of trustees for, I think this is going into my 4th year soon, and as their secretary treasurer, and I just thought, if there's a place to spend my time, my precious free time, changing in a big picture approach the way we view healthcare, and the way we view the chronic disease of obesity, is the place to be. So that is how I became involved with the Obesity Medicine Association. I do some American Board of Obesity Medicine review lectures for physicians who are trying to become certified in this field of medicine. I will mentor young up and coming physicians who are interested in possibly practicing and getting certified in obesity medicine. As a national organization, this is a great place to be putting my efforts in there to to kind of change kind of like the face of primary care.
I could tell she would be a good mentor from day one. The way that she communicates her knowledge, the where she achieved at this point. She's an excellent teacher. So I even see how she communicates with her own kids. The language. So if you're able to convince somebody on a simple language of what is the reasonings, I think you do a good job in terms of teaching.
It's great to be able to take some of the knowledge base that I have, and to be able to hopefully inspire other young physicians to to think about this as the specialty they would like to be a part of, and then so I think from an educational standpoint, for me, that it's great to be in a position where I can educate others, I can inspire others, I can mentor others, and every day I do see patients here in this practice, in addition to my other responsibilities, and so it just keeps it. It keeps it front and center. It keeps it real. Some of the best advice that I ever received was actually at an OMA lecture. I remember this, and I don't recall her name anymore, but I definitely recall what she said. She got up on stage, and it said, this is an incredible field. I love what I do, and the advice that I would have to give you is, read up. Read everything you can. Learn as much as you can about this field. And soon one day you'll become an expert as well, and essentially reap the benefits of being able to help patients in this way. And so my, I guess the advice I would say is, this is time well spent, and be a lifelong learner. Be open to to other ways of managing patients. Be open to understanding primary care through the lens of treating the root cause of disease, and learn as much as you can about it.
I'm proud of her. I think she's an outstanding physician, a great communicator. somebody that transforms her experiences, uses, her adaptability to situations is amazing. And her being willing to change, to move things, amazing. So very proud and very honored to be her friend.
It's good to be able to have someone to lead the provider recruitment, the provider quality, the clinical care pathways, and build those out so that we can tackle this big epidemic. So I think that that's going to be our biggest challenge yet, is to get all of that done, but she's definitely the one who